Today, we're looking at a huge shift in how we approach surgery. The idea is this: surgery isn't just something that happens to you, it's something you can actively train for, kind of like an athlete getting ready for a marathon.
So let's start with a really interesting question. What if the most important part of your recovery didn't happen in the hospital bed, but in the weeks before you even go in for the operation? That's the powerful idea we're digging into today.
For the longest time, the approach to surgery was pretty passive. You get your diagnosis, you get a date on the calendar, and then you just wait. But that's all changing. A new way of thinking is taking over, an active approach, where you actually train and prepare your body to handle the stress of the whole thing. And this new approach has a name: prehabilitation. It's basically a training camp for surgery, and it's designed to get you into the best possible shape to face what is, for your body, a massive physical event. This is the perfect way to think about it. Surgery is like a marathon. It's a huge stressor on your body. And you'd never just roll out of bed and run a marathon without training, right? So why have we, for so long, faced major surgery without preparing for those exact same kinds of physical demands? So what is prehabilitation exactly? Well, it's not just one thing. It's a structured program with a few key parts. Think of it as a three-pronged strategy. You strengthen your body with exercise, you fuel it with the right food, and you fortify your mind with psychological support. And this all happens in that critical window of time between getting a diagnosis and having the surgery. And this, right here, is the real mindset shift. For years, the focus was all about identifying a patient's risks, predicting what might go wrong. Prehabilitation totally flips the script. Now the goal is to actively reduce those risks, giving patients the power to improve their own outcomes before they even set foot in the hospital. So, how does this actually work? Well, it all boils down to what experts call the 3 pillars of prehab. The whole program really rests on these 3 pillars, and each one is designed to tackle a different part of building up your resilience. We've got building strength, fueling the body, and fortifying the mind. Let's break down each one. First up, exercise. The main goal here is to build up your physiological reserve. That's basically your body's backup battery, its ability to cope with major stress. And this isn't some generic workout. It's a tailored plan that mixes cardio, resistance, and balance training, all designed using something called the FIT principle to get you ready for the huge metabolic demands of surgery and recovery. Okay, pillar number 2 is nutrition. This is huge. Major surgery, especially for cancer, can put the body into what's called a catabolic state, where it starts breaking down muscle for energy. To fight that, prehab focuses on anabolism. That's muscle building. This usually means a really high-protein diet, sometimes double the normal amount, often with specific supplements like whey protein to give your muscles exactly what they need to repair and grow stronger. And the final pillar, psychology, is just as important as the other two. Think about it. A major diagnosis and upcoming surgery are incredibly stressful. High anxiety can actually hurt your physical recovery. So this pillar uses things like mindfulness and relaxation techniques to build up your mental resilience. Not only does this improve healing, but it gives patients a much-needed sense of control over their situation. Okay, so the theory is solid, but the big question is, does it actually work? And how does it fit in with other modern ways of handling surgery? Let's take a look at the evidence. First off, it's really important to know how prehab fits with something called ERAS, or Enhanced Recovery After Surgery. You can think of it like this. Prehab is what you do before the surgery to build your body up. ERAS protocols are what the medical team does during and after the operation to reduce stress. They aren't competing ideas. They're 2 halves of the same whole, working together for the best possible recovery. So, what do the results look like? Honestly, they're pretty compelling. Some of the big studies on major cancer surgeries found that prehabilitation could cut the time spent in the hospital by an average of 2 full days. Just think about that for a second. 2 fewer days in a hospital means getting back home to your family that much faster. And it goes way beyond just the length of your stay. We're talking about a real shot at reducing complications. We already know that protocols during surgery, like ERs, can slash complication rates by over 30%. The whole point of prehabilitation is to make those numbers even better by making the patient stronger before they even get to the operating table. And get this, it's not just good for patients. It's also good for the healthcare system's budget. A study in the Netherlands crunched the numbers. The program cost a little over €1,000 per person, but by preventing expensive complications, it saved the system more than double that amount.
That's a net savings of over €1,200 for every single patient who went through the program. So who stands to gain the most from these programs? Well, the evidence points to a few specific groups. We're talking about elderly or frail patients, people who are already malnourished or have muscle loss, and anyone starting with a low level of physical fitness. It's also especially helpful for those going through massive surgeries and for patients who are dealing with a lot of anxiety. Basically, it's for anyone who needs to build up that reserve before a major challenge.
Prehabilitation is clearly a powerful tool. So the next big question for researchers is, how can we make it even more precise and even more effective for every single person?
And that leads us to the next logical step. If this approach works so well in general, how do we fine-tune it? To go from a great idea to a perfectly tailored treatment, researchers are now looking much deeper. They're trying to figure out all the hidden factors at play, which they call third variables. So what are these third variables? They're basically all the factors that help us really understand the connection between prehab and recovery. They help us answer the most important questions. Why does this actually work? Who does it work best for? And how exactly does it lead to success?
This kind of breaks down into three main types. First, a mediator explains how the program works. For example, prehab improves your walking ability, and that is what leads to a faster recovery. Second, a moderator explains for whom it works best. Like, it has a much bigger impact on patients who start out with low fitness. And finally, a confounder is some other factor, like a patient's age, that could be influencing the results and needs to be taken into account.
So, by figuring out all of these variables, the research can finally move past a one-size-fits-all model. The future is all about creating super personalized prehabilitation plans, getting the right intervention to the right patient at exactly the right time to get the absolute best result. Which really leaves us with one last big thought. In this age of incredible high-tech medicine, is it possible that the simple, empowering act of preparing your own body for a challenge could be one of the most powerful medicines we have? The evidence is certainly pointing that way.